I don't know whom is in this group is very familiar with taking blood pressure.
Yeah.
Everybody knows?
Yes.
Who has never done it? No, all know. So
So
it will be, yeah, you can. So it will be maybe a repetition you might know already, but that doesn't really matter. That's okay, it's fine. So, to start, what is it exactly? Maybe, wait, I go back a little bit. You can tell yourself, what is that, measuring the blood pressure? What does it mean? Why do you do that?
To see if the blood pressure is high or low.
Yeah, and what information do you get then? What does it tell you about the condition of the patient?
If he has a high blood pressure or low.
Yeah, and what can it mean? Do you know that? About which part of the body it gives you information?
More of the heart, I guess.
Yeah, and
veins.
yeah, the condition of your circulation system. Yeah, good, very well. So in fact, what you measure is the pressure of the blood on the inner part of the veins or the arteries. Yeah. So in fact, you can measure blood pressure on different levels of the circulation system. So starting from the heart, you have the arteries, the artery system that goes to all the organs. Yeah. And that's this part. So you can see that the walls, yeah, sorry, they are very thick.
Yes.
Do you have an idea why that is?
Because there is a lot of pressure there.
Yeah, of course. If it wasn't like that, it would explode. Yeah? But then it goes to the organs, the tissues, how do you say the tissue? Yeah?
Yeah.
And there you have a capillary system. What is very small, tiny, yeah? And then there will be a lot of yeah, some things going on. Some things go out of the blood, like for example, the oxygen, and come in, and then it goes to the venous system. And if you compare now the wall of the veins, what can you see? It's different. What is the difference, you think?
Valves and smaller.
Yeah, it's less thick. It has less muscles inside because the blood pressure is much lower there. Yeah. So in fact, you can measure blood pressure here on the artery, on the capillary level, or on the venous level. Yeah. But what we are going to do today is what is here, the artery level. Yeah. But you can do it also on other things, but you need other material. It's not with a normal BP machine that you will do it. You know that, I think. So, maybe I go back a little bit. Sorry. Okay. In blood pressure, you will measure different things. What do you measure there? There are different moments that you. Yeah. So what is the systolic? What is that?
It's the contraction of the heart.
Yeah. So then the pressure will be low or high? High. Yeah. It goes like. Yeah. And then the diastolic is relaxation, because there will be always a pressure. Yeah. The blood is there, so it will always. It's never zero. If it's zero, then you're in big problem. Yeah. So. You can also see or compare the two with each other, and then we call it differential blood pressure, but we are not really going to talk about that. So here is a little bit how do you say that? The numbers. But yeah, indeed, and what you explained already what it is. So these are the values we use in our school. It might be a bit different to what you've seen. So we say the systolic BP in millimeter quick, you say quick, yeah? Is 110 till 140. and the diastolic between 60 and 90, but it might be slightly different in your country. So here you can see, and you can see what we call still normal is already in the orange. So it's possible that you have it like this. So if it's above the normal values, you talk about hypertension, and if it's below, it's hypotension. So that are the main things, I think. Maybe you can also tell me, when do we measure the blood pressure? When do we do that? What are the indications to do it?
It could be fatigue and headaches.
Yeah, so some symptoms your patients might have.
Yes.
Dizzy.
Yeah,
Yes.
and you say, it's not going well with this patient, paleness, maybe fainting. He tells, I'm not feeling well. I have to take the blood pressure. And what are other...
In the mornings.
Yeah.
Before medication.
Yeah. Why do you do it before giving the medication? What do you think?
Because it can influence the medication. Yes.
Yeah, suppose he has a very low blood pressure and you're not really noticing it. You give maybe medication to make the blood pressure lower, and he has already. Oh, then it's a problem. So always do it before you really start working for the or doing something with the patient. It's also sometimes the physician what will ask you to do. For example, also after all the how you say that, surgical interventions, we will follow up. Why do we do that after surgery? Do you know?
To make sure that the system is working.
Yeah, and we are a bit anxious because what is possible that will happen?
Bleeding.
A bleeding,
Yeah.
and then you can see it. If the bleeding is internally, you won't see it outside, but you can measure it. So there are some things, conditions. People with heart condition, for example, they will also benefit from being checked, and then really in relation to the medication. But I think you already mentioned it. Yeah. Okay. The equipment. I think you all know. There are different types of equipment. We really like this one because very easy. Yeah. So this one is very popular, but not always very accurate. Yeah. In fact, this one is the best one, the one with the quick inside. But quick is also having some other problems because if it breaks and it falls on the ground, it's very toxic. So we don't, in Belgium we are not really allowed anymore. And in fact, this is the best way to measure, is this one. So here is the one we might not really like a lot, but it's also a very good way. It's what we call, I don't really know, it's translated well, spring manometer. So it's just this kind of manometer, what we call like that. So the two of that we use a lot. This is not in use anymore, but it exists still. So and we are going to do it with this. Yeah, the manual blood pressure measuring. Yeah. So here I first wanted to say all the steps, but I think you know it already. But maybe what is interesting is to know how it works. So you put the cuff, you call it on the upper arm. Which arm do you prefer? Left. But there are some exceptions. Do you know the exceptions?
Breast cancer.
When they took out the... Yeah. When also not...
What if you have
If there's a wand,
Is it still the same?
The pacemaker is not always a problem, but...
if there's a wand or
A wand, yeah.
the
The Baxter,
yeah.
Yeah, hemiplegie. So when the... How is it?
Paralyzed.
Paralyzed. We won't do it. Otherwise, if it's possible, we do it on the left side because it's closer to the heart and you will better hear the sounds. Yeah? So in fact what you do, you put the cuff there and you make pressure on the cuff. And what you do is you just close the artery. You do a lot of pressure that the artery is just closed. There's nothing passing anymore. And your patient will feel the tinkling because the blood is not coming. So what you can do is ask your patient what is his normal blood pressure, and then you go a bit above, that you're sure that the artery is closed. Yeah, and then you put the stethoscope in your ears. Best is to put the two things a bit towards your nose, because your hearing system will be adapted and you hear it better. You put the stethoscope on the artery is passing here on your elbow, here more or less, so you put it there, and you take the cuff, how you say that? The balloon, and your hand, and you lose the pressure slowly, and you read what is the pressure, and on one moment you hear a sound. That's the moment the blood is passing again, and you think, okay, that's the systolic, thank you, systolic pressure, and then you hear tuk, 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 and suddenly it will stop. So that will be the diastolic. Yeah? So here you see it again, yeah, the different stages, and here it is linked with some, here they suppose the patient has 120/80 millimeter quick, so you pump it up, and then on a certain moment when it's above 140 it will just stop passing, and then you lose it and you will measure the first sound and when it disappears. That are the different steps. It's important that your patient is in a comfortable position, so he should be sitting or laying down, very important, but yourself as well should be, you have to think about the ergonomics, so you can sit besides the bed or the sitting patient on another chair, so don't forget that, because if you're standing there with back pain, you're not able to do it in the right way. Okay? Yes. Is it clear for you? Are there questions? No. So we will do a demonstration. Here we have really brand new, they arranged for us, very nice equipment. The stethoscope and the, who would like to demonstrate? Because you're already very much specialized. Who would like to be the patient? Yeah. So you can take your chair and sit here a little in the middle, that everybody can see you. Yeah. And then somebody else can take the pressure. Then I can comment a little bit. Who wants to do it?
We haven't tried that one in Denmark, so
No.
I'd like
Okay.
to see it first.
You want to do it?
No, but everyone has
Yeah, but this
to
is-
try.
This is
Yeah.
demonstration.
Yeah.
And afterwards we will just do it. Just okay. So she will take, and if you turn around,
Sorry.
you wait.
Dat is, ja, dat is
Oh, no.
Dit is zoals het.
Nee, so.
Okay.
So you see, but if she turns around, the things are towards her nose. Yeah? Yeah, she tests if it's on the right, because sometimes you can swap
Yeah.
this thing. The cuff, it's a bit tight. Yeah. So the cuff has this two, not all, yeah, two things. Sometimes it's in one,
Can I?
integrated in one. So you make sure that here, even they mentioned artery, you know that the artery is in the inside part of the arm.
Yes.
So these two things should be there. And in fact, you should be able to, if you are right-handed, to take the balloon in your right hand and to fix
Die stijken.
the, yeah,
And
you're sitting, maybe you can sit on her place and we take this, yeah, as you said, it's, you have some comfort, yeah. So she will take, zit je rechts op?
Beide.
Okay, so she fixes the stethoscope with one hand and she will, how do you say that, operate the cuff with her other hand. Do you know your blood pressure?
Oh, not really.
Not
It's a bit
really?
low.
Bit low, so we will go up to 180 or 190. Yeah, is it working? Wat doe je doen?
Mevrouw, ik was niet.
Sorry.
Wacht, ik ga je terug.
Cool. Wacht, doe nog eens even. Just stop. So she has done it to 200 millimeter quick. Then she will open with her one hand this balloon, and you see the pressure going down. Yeah, ooh, this is too quick. And then on a certain moment you will hear toek. That's the moment the blood passes again. Ze is echt vrij laag, dus waarschijnlijk dat hier is. I think she can hear it.
11:70.
So she heard it around, wat was de eerste keer dat je hoorde?
Around here. Just
120?
Around.
110. She already mentioned it is a bit low. So, and then it stopped. She hears the heart pounding, tuk tuk tuk. She lowers on the same moment the pressure in the cuff. And when it was on 70 millimeter quick, it disappears, the sound.
Okay. So
So that's
110
the
over 30.
Diastolic.
Yeah.
Diastolic. The thing is, the tricky thing is, if you watch this, you will first see pounding.
Yes.
Because this small arrow, it will go like this. And then you say, oh, it's already there. But you really have to concentrate on what you hear. Because it's the moment you hear, that's the moment. Not when you see it. You understand?
Yes.
Yeah. So, let's do it. So you can make pairs of two. I think we have enough equipment. So you take...